Most people think that when they turn 65, Medicare is going to be this perfect healthcare safety net. And honestly, the government kind of sells it that way too. It's held up as this great reward for a lifetime of work, a promise that you'll be taken care of in your retirement years. But I'm here to tell you that that promise comes with some fine print, some very, very expensive fine print at that. The truth is, there are some big, expensive secrets hiding in the Medicare system that can lead to real financial trouble. There's shocking gaps in coverage for everyday healthcare needs that can drain your retirement savings faster than you'd believe. My name is Tim Smith, and for the last 5 years, I've been a licensed insurance professional who specializes in Medicare. I've sat at hundreds of different kitchen tables with folks just like you, people who are shocked, confused, and frankly, a little scared when they found out about the holes in Medicare. They felt like they've been misled, that the system is built to be confusing. In this video, we're going to pull back the curtain on the 8 most dangerous secrets about Medicare. These are the things that you won't find in the glossy brochures. Knowing this stuff isn't about being paranoid, it's about being prepared. It's about protecting your health, your family, and your savings in retirement. And the first secret is the one that blindsides almost everyone when I talk to them. So please stick with me to the end of this video because you don't want to miss any of these Medicare mistakes. Number 1, the dental, vision, and hearing gap. All right, let's get into the first one, and it's maybe the most common surprise for people that are new to Medicare. Secret number 1 is that original Medicare, that's parts A and B of Medicare, will not pay for most dental, vision, or hearing care. Now I'll say that again because it's so important. For the most part, your teeth, your eyes, and your ears are on their own when it comes to Medicare. Just think about that. As we get older, what are the 3 first things that usually need a little extra help with? Our teeth wear down, our vision gets fuzzy, and our hearing isn't quite as sharp as it used to be. This isn't some rare medical condition. It's just a normal part of aging, and yet the main health insurance for Americans over 65 basically pretends that these parts of the body don't need routine care. Now let's talk about what this secret actually costs. Have you seen a dentist bill lately without insurance? It's pretty scary. A simple cleaning and checkup can run a few $100s. Need a filling? Add a couple $100 more. But what if you need major work done? A single root canal can easily cost over $1,000. In a crown, you could be looking at anywhere from $800 to $2,500 for one tooth. Now imagine you need a few of them, or you need dentures. You could be looking at costs in the 5-figure range, all coming 100% out of your pocket. It's the same story for vision. Routine eye exams to get a new pair of glasses are not covered. The glasses themselves, not covered. Contacts, not covered. Now, Medicare might cover an eye exam if you have a condition like diabetes or glaucoma, and it will cover cataract surgery, but the glasses you need after the surgery, that's on you. And a good pair of progressive lenses can easily be above $500. And then we have hearing. Hearing aids are a total lifeline for millions, connecting them with their loved ones and the world. But they're also unbelievably expensive, oftentimes costing thousands of dollars for a pair of hearing aids. And you guessed it, original Medicare doesn't cover them. It also doesn't cover the exams to get fitted for them either. This isn't just an inconvenience, it messes with your quality of life. Not being able to hear properly can lead to isolation, depression, and even been linked to a higher risk of dementia. So why is this a secret? Because it goes against everything we've learned about health insurance. Most plans we have through our jobs have at least some dental and some vision and some hearing coverage. We're used to thinking of our body as a whole system, but the government promotes Medicare as this all-encompassing health security while quietly leaving out 3 huge areas. Number 2 is long-term care. If this first secret was a punch to the gut, this next one is a potential knockout blow to your entire financial plan. Long-term care is probably the biggest and most expensive misunderstanding in all of Medicare. Original Medicare does not pay for long-term custodial care. Period. It does not cover it. This is the giant looming issue in American retirement that no one seems to want to talk about. Let's be very clear about what custodial care is. It's help with the basics of daily living. Things like bathing, dressing, eating, getting in and out of a chair, or using the bathroom. It's the non-medical help millions of seniors eventually need because of a chronic illness, something like Alzheimer's, or just the natural process of getting older. This is the type of care that you get in a nursing home or an assisted living facility, and Medicare pays almost none of it. Here's where people get confused and into trouble. They hear that Medicare covers nursing homes, but they don't catch the fine print. Medicare Part A will only cover short-term skilled nursing care, right after you've been formally admitted to a hospital. For example, you fall and break your hip, you're in the hospital for 3 days for a surgery, and then you go to a facility for physical therapy to get back on your feet. In that specific case, Medicare covers the first 20 days. For days 21 through 100, you have to pay a daily coinsurance, which is $209.50 each day in 2025. And after day 100, you're paying for everything. But here's the real catch. The second your care is no longer considered skilled, meaning you've stopped improving or you just need help with daily living, Medicare cuts off entirely. It doesn't matter if it's day 15 or day 85. The moment you just need custodial help, you're on your own. And what does on your own cost? It's a financial nightmare. The average cost for a private room in a nursing home is now over $120,000 a year. Let that sink in, $125,000 per year. Assisted living isn't a whole lot cheaper either, and having a home health aide can run nearly $7,000 a month. How many of us in our retirement plan can handle a $10,000 monthly bill? This is the number one reason families go broke in retirement. They think this huge expense is covered, and by the time that they learn it's not, it's already a crisis. They end up having to sell their homes, burn their life savings, and basically spin down to qualify for Medicaid. And that's another thing to get straight. Medicare and Medicaid are two totally different things. Medicare is the health insurance you earn from paying taxes. Medicaid is a welfare program for people with very low income and very low assets. To get Medicaid to pay for your nursing home, you have to prove that you're broke. It's the last resort, not the safety net that you thought you had. Number 3 is the myth of free healthcare. Okay, let's tackle the next big secret, the one that hits your bank account every single month. Secret number 3 is the myth that Medicare is free. It's not. It's not even close to free. For a lot of retirees, Medicare premiums and other costs end up being one of the biggest monthly expenses and oftentimes a total surprise. So let's break down all the costs that are hiding in plain sight. First up is Medicare Part A, the hospital insurance. They like to say it's premium free, and it is for most people. What that really means is you prepaid it by paying Medicare taxes for at least 10 years. If you or your spouse didn't hit that 10-year mark, you have to buy Part A. In 2025, that could cost you either $285 or a whopping $518 every single month. But the real shock for most people is Medicare Part B, which covers your doctor visits. Everyone on Medicare has to pay a monthly premium for Part B. You can't get out of it. For 2025, the standard premium is $185 a month, and that's per person in the household that's above 65. And that's just the standard premium. Here's another hidden cost. Your Medicare premiums are oftentimes tied to your income. It's called IRMA, the income-related monthly adjustment amount. If your income from 2 years ago was over a certain level, you'll pay more for Medicare Part B. For 2025, those extra charges kick in if your 2023 income was over $106,000 as an individual or $212,000 as a couple. And we're not talking about a small change. Your Part B premium could jump to $259 a month or even as high as $628.90 a month per person. Can you imagine getting hit with a bill of over $600 a month just for one part of your health insurance? It happens to a lot of people and they have no idea that it's coming. So now you know your Part A and your Part B premiums, but we're just getting warmed up. On top of those, you have deductibles. Before Medicare starts paying, you have to pay these first. For Part A, if you're admitted to a hospital, you owe a deductible of $1,676 in 2025. And that's not per year, it's per benefit period. So if you go to the hospital, get out, and have to go back more than 60 days later, you will have to pay that $1,676 all over again. For Part B, there's an annual deductible of $257 in 2025. Once you've paid that, you're still not in the clear. This leads to one of the sneakiest costs of all. Coinsurance. For most things under Part B, doctor visits, outpatient surgery, medical equipment, you pay 20% of the cost, and there is no cap on this. If you have a $10,000 outpatient surgery bill, you're going to owe $2,000 if you only have Medicare Part A and B. If you get cancer and need chemotherapy drugs that cost $100,000, you could be on the hook for $20,000. Number 4 is the unlimited financial risk of original Medicare. This next secret is tied to the last one, but it really needs its own spotlight because it is a level of financial risk that you don't see in your other health insurance plans today. Original Medicare has no out-of-pocket maximum. There is no cap, there is no limit, no safety net. If you've had insurance through a job recently, you know about maximum out-of-pockets. It's the absolute most that you have to pay for your health care in a given year. Once you hit that number, the insurance company pays 100% of everything else. It's a crucial feature that protects people from going bankrupt just because they got sick. Now, Original Medicare does not have that. The 20% coinsurance we just talked about, it goes on forever. Let's walk through a common real-life scenario. Imagine a retiree, let's call him John, gets diagnosed with cancer. His treatment requires a couple of surgeries, lots of specialist visits, PET scans, and a long round of outpatient chemo. The total bill for that care for the year could easily hit $500,000. First, he's going to owe the hospital $1,676 because of that Part A deductible. Then he has his $257 Part B deductible. After that, he's going to owe 20% of all the Part B costs. So 20% of a bill that's pushing $500,000 could be close to $100,000 that John has to pay out of his own pocket. Because like we said before, there is no ceiling. If his treatment cost $1 million, his 20% share would be $200,000. This isn't just a scary story, it's how Original Medicare is designed. This is a secret because most people that are new to Medicare are confused and think that they only need to take out Medicare Part A and Part B. But Original Medicare Part A and Part B gives you no peace of mind whatsoever. It leaves you totally exposed. This is why most people don't use it by itself. They have to buy another private insurance policy called a Medigap or a Medicare Supplement plan or a Medicare Advantage plan to plug the holes. And these plans have their own set monthly premiums, which is yet another cost on top of the not so free price of Medicare. Number 5 is prescription drugs. Let's talk about our 5th secret, which is something that almost every senior needs, and it's prescription drugs. Secret number 5 is that Medicare drug coverage Part D is a confusing and often expensive maze. And even though you may have heard some great news and new changes that are coming, they don't make the problem go away completely. First off, the biggest thing that people don't realize is that Original Medicare does not cover the pills that you pick up at the pharmacy. If you only have Parts A and B and you go to Walgreens, you're going to pay 100% of the cost. To get coverage, you have to sign up for a separate standalone Part D plan or a Medicare Advantage plan that's sold by private insurance companies, and typically they have monthly premium. This is where it gets a little complicated. In any given area, there might be dozens of Part D plans to pick from. Each has a different premium, a different list of covered drugs called a formulary, and different copays for those medications. If you choose the wrong plan, it could cost you thousands of dollars extra each year. Now let's talk about the big change for 2025. Thanks to a new law, there is now a $2,000 annual cap on out-of-pocket drug costs for people on Part D. This is a huge, long overdue improvement. It means that once you spent $2,000 of your own money on covered drugs, you pay nothing for the prescriptions for the rest of the year. This gets rid of the old catastrophic phase where people could still face massive bills. This is great news and it's been all over the headlines. But here's the secret part. A $2,000 cap doesn't mean your drugs are cheap now. It just puts a ceiling on things. Before you hit that cap, you're still paying your way through a pretty expensive system. First, you have your monthly premium for the Part D plan itself. The national average is around $37 a month in 2025, but it varies depending on what medications that you're taking. Then, most of the plans have an annual deductible, which is $590 in 2025. That means you pay 100% of the drug costs until you've spent $590. However, the deductible on most plans only applies to the higher tiers of drugs. Tier 1s and Tier 2s, the deductible most likely won't apply. After that deductible, you start sharing the cost with your plan. Usually you'll pay 25% of the drug price or a flat copay for each prescription. You keep paying the share until your total out-of-pocket costs hits the $2,000 mark. So while the unlimited risk is gone, you could still very easily be on the hook for $2,000 for your drugs, plus your monthly premiums all year long. For a couple, that's potentially over $4,000 out of pocket, plus more than $1,000 in premiums. And the headache of choosing a plan is still there. Every plan has its own formulary. If your specific drug isn't on that plan's list, you might have to pay full cost, and the money might not even count towards that $2,000 cap. Number 6 is traveling. For a lot of us, retirement is a time to finally travel and see the world. But our 6th Medicare secret can turn that dream vacation into a financial nightmare. Here it is. In almost every case, original Medicare gives you zero coverage outside of the United States. The second you're on foreign soil, whether you're on a cruise, touring Europe, or just popping over the border to Canada or Mexico, your Medicare card is basically a useless piece of plastic. If you get sick or hurt, you're paying 100% of the bill. This is a huge shock for retirees who just assume their American health insurance travels with them. It doesn't. Hospitals and doctors in other countries won't accept Medicare, and they won't file claims for you. You'll have to pay the entire cost right then and there, and it can be a fortune. Now, there are a few extremely rare exceptions. For example, if you're in the US and have an emergency and the closest hospital is actually across the border in Canada or Mexico, Medicare might pay. But for 99.9% of travel that people do for fun, you have no coverage. So what are you supposed to do? You either need a separate travel insurance policy with medical coverage for each trip that you take, or you need a certain kind of Medicare Supplement or Medigap plan. Some Medigap plans offer a foreign travel emergency benefit, but even that is limited. It usually only covers the first 60 days of a trip, has its own deductible, and only pays 80% of the bill, up to a lifetime maximum of $50,000. That's way better than nothing, but a really serious medical event could blow right past that limit. Number 7 is there is no family plan. All our working lives, we're used to thinking about health insurance in terms of individual or family plans. When you start a job, you pick coverage for yourself, or you and your spouse, or your whole family. Our 7th Medicare secret completely throws that idea out the window because there is no such thing as a family plan when it comes to Medicare. Every single person is on their own. When you turn 65, you sign up for Medicare for yourself. Your spouse, even if they are also over 65, can't just be added to your plan. They have to sign up and qualify on their own. This means that every single cost that we've talked about so far in this video, every premium, every deductible, every copay, is per person. Let's do the math for a retired couple. The standard Part B premium in 2025 is $185 per person. So for a couple, that's $185 times 2, $370 every single month. That's over $4,400 a year just for Part B. And what if you have a higher income and get hit with those IRMAA surcharges? A couple whose 2023 income was over $212,000 a year will each have to pay that extra amount. So their combined monthly Part B premiums could easily be over $700, $800, or even more than $1,200 a month if they're a higher income earner. The deductibles are also per person. The Part B deductible is $257 this year in 2025. For a couple, that's a combined $514 that they have to cover before Medicare's 80% coverage starts. If both of them end up in the hospital in the same year, they could each have to pay the Part A deductible, the $1,676 per stay, and that's over $3,300 total. And if they need drug coverage, they each have to buy their own Part D plan. That means 2 monthly premiums and 2 separate deductibles before each of them get to hit their $2,000 out-of-pocket cap. The secret is the huge mental shift that you have to make. People just see the word Medicare and think it's one thing you get when you retire. They don't realize it's an individual plan that doubles the cost and complexity for a couple. It fundamentally changes the math for healthcare in retirement, and if you don't plan for 2 of everything, you can end up with a lot less money to live on than you expected. Our last secret is one of the most frustrating because it feels like you're being punished for not understanding a system that is confusing. Secret number 8 is that the Medicare system is full of late enrollment penalties that last for the rest of your life. If you miss your sign-up window and don't have other qualifying insurance, the government will charge you a higher premium forever. It's not a one-time fine. It's a permanent penalty that gets bigger the longer that you wait. So let's start with the most common one, the Part B late enrollment penalty. You have a 7-month window around your 65th birthday to sign up for Medicare. If you don't sign up for Part B during that window and don't have health coverage from a job or your spouse's job while you're still working, you will get hit with the penalty when you finally do enroll. And here's how they calculate this lifetime penalty. For every full year that you could have Part B but didn't, your monthly premium goes up by 10%. For example, say you retire at 65 but think, I feel great, I'll save some money and wait to get Part B. You wait 3 years, your penalty will be 30%. 10% for each year. And in 2025, the standard Part B premium being $185 a month, your penalty would be an extra $55.50 a month. and that's for the rest of your life. And as the standard premium goes up with inflation over the years, your penalty amount also goes up because it's always a percentage of the current premium. Now, there are also penalties for Part D drug coverage. If you go more than 63 days in a row without some kind of drug coverage after you were first eligible for Medicare, you'll get a Part D penalty. They calculate it, add it to your monthly Part D premium, and just like the Part B penalty, you pay it for the rest of your life. Now, why is this a secret? Because the government does a terrible job of explaining how serious and permanent these penalties actually are. People are flooded with confusing information about enrollment periods and special rules, and it's so easy to make a mistake. A lot of people who work past 65 are tripped up by the complicated rules and end up having a lifetime penalty because of it. Now, I know we covered a ton of information today, and trying to avoid all these penalties and all these mistakes is really a hard task. But if you need help, I want to personally invite you to call the number on the screen. The best way to sort through all of this is to talk to an independent licensed agent who can look over all your options from all the different companies in your specific area and guide you through them and even help you enroll. And all of our services are 100% free of charge because we get paid through the insurance companies to help you enroll. So if you'd like to take advantage of that, you can schedule a free, no obligation chat with me or a member of my team, and you can just click the link in the description or call the number on the screen, and we would be more than happy to help you. Now, thank you so much for watching. I hope you found this video truly valuable. If you did, please subscribe and click the notification bell so you don't miss any of our future videos where we break down everything about Medicare. Now go check out this video where we go over all the price updates for 2026 that you need to know about. I'll see you over there.